what are like some absolute pearls? I might just pick a few topics out of that. So, ways to avoid dehydrations and signs that that's going to happen, but could be avoided. What would your advice be there?
So if we're talking like a tummy bug, unfortunately, like I always tell families, puking kids are absolutely miserable. And like my least favorite bodily fluid out of all the things that I deal with is for sure vomit. So puking kids are not fun. My biggest piece of advice when it comes to kids that have a stomach flu is number one, typically the vomiting is acute and lasts anywhere from about 12 to 24 hours. And in those moments, it is crucial that we give frequent small sips of water or fluid. You don't want to just let your kid douse a whole, Stanley or Hydro Flask full of water because they're just going to puke it right up. But you want to be giving about 1 to 2 ounce volumes about every 10 to 15 minutes. And the best way to monitor your kid's hydration status at home is their urinary output. So if at any point your kid goes 8 to 12 hours without having urine output, at that point is when I would raise concern to your pediatrician. And depending on the time, consider going into the ER if your pediatrician's office is closed.
Perfect. I get this question a lot. How do you feel about juice and ice pops when they are, yeah, in that stomach bug?
Such a great question. I think it absolutely plays a role in vomiting and diarrhea, dehydration picture. I think it's very important that we realize that extremely concentrated forms of juice actually feed that gut bacteria to overproduce because bacteria feeds off sugar. However, I think it's very important that we maintain a child's sugar levels. And so I think incorporating something like a 100% like organic apple juice diluted with water at about a 50 to 50 concentration, and or implementing something like coconut water that has a ton of electrolytes, or something like a Pedialyte is a great option to maintain their blood sugars, because the more kids puke, the more option or chance they have of getting lethargic. And so those blood sugars help to maintain that lethargy status and avoid them becoming lethargic. But an over amount of sugar, I think, also kind of feeds that gut bacteria and can make things worse. And you want to avoid anything acidic because that can just be really harsh on their belly. So that's my biggest piece of advice. And I hope that you guys agree with that.
Yeah, yeah, absolutely. I think we're always counseling between like, don't give them sugar and then, but we need to hydrate them. So I think
Yeah.
there's a healthy balance there of like, let's prioritize this acute event. We just need to get fluids in. Sometimes it's whatever they will take, and then we just back off of it the disease process progresses. So to absolutely agree. Okay, so I think another big emergency that hopefully we could avoid the ER and teach parents about is these respiratory viruses where the kids really get into trouble. These are very scary
Yeah.
to me with my own kids, even knowing what I know. So, what are signs parents should look out for? How do they avoid the ER for these viruses?
Yeah, such a great question. So I think I always teach in my classes the viral process when it comes to respiratory conditions is vastly different depending on a child's age. Okay. So going from age, let's say 0 to 12 months, considered like infancy, these kids are obligatory nose breathers. What the heck does that mean? That means that they are created to breathe through their nose exclusively so that they can open their mouth to take a bottle or a breast. So, in the acute beginning phases of any signs of a respiratory condition, runny nose, congestion, like that snorting kind of breathing, at any initial sign of a respiratory infection for infants, my biggest piece of advice is hydrate, 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 and clear their airway, meaning suction them when it matters. So I always tell families, infants that are obligatory nose breathers, and like I mentioned, created to breathe through their nose so they can feed with their mouth, it is crucial to suction them before feeds and before bed, because we all know we're all trying to get a little sleep, right? So before feeds, it's crucial that you suction your baby so that they can have a clear airway so that they can breathe, suck, swallow. If you do not suction your infant before a feed and they're super stuffy in their upper airway, they're not going to take an adequate feed. An inadequate feed, can lead to dehydration. Dehydration, like we mentioned just a minute ago, can lead to low blood sugars and lethargy. And a lethargic baby is not a healthy baby. We do not want our babies to get lethargic.
Yeah.
So when it comes to infancy, my biggest piece of advice for you would be to suction when it matters, before feeds and before bedtime, and maintain their hydration. Like I mentioned, making sure they're having wet diapers, they're peeing, and they're taking their normal volumes of feed. As we progress in a respiratory condition, whether it's infancy or a young child, toddler age, or even a bigger kid, I always also tell families to check on like YouTube on signs and symptoms of increased work of breathing. It is crucial that parents can recognize mild, moderate, and severe signs of work of breathing for their child's age group. So if a family has a 6-month-old baby, I always say hop on YouTube and search 6-month-old increased work of breathing so that you have a physical presentation of what that looks like so that you know when to escalate care. And I always tell families that even at the initial start of increased work of breathing, so if at any point you notice your child's having nasal flaring where their nostrils are flaring in and out, that's not normal. Or maybe they're pulling or tugging in their neck area or in their ribs, or they're breathing fast with their belly. Those aren't normal breathing patterns. So if at any point you recognize this during even the beginning, day 1 of a respiratory infection, I recommend recording it with your phone so that when you take your child to the pediatrician or you go on Blueberry Pediatrics, you can upload imaging and video of your child so that the doctor has a very black and white presentation of what your kid looks like. And that can help them navigate the plan of care. It's hard as a medical provider to just kind of have it be hearsay without seeing physically what's going on. And so I think that that's a huge piece of advice that I give families that has been so helpful. And then the last thing I would say is just trust your gut. If at any point you're concerned about your child's well-being and they have a respiratory infection, typically respiratory viruses peak around days 3 and 4. So if around day 3 and 4, your kid is just not getting better, you're worried about them, they look like they're miserable, obviously they're having any color changes, there's a reason that there's an emergency room, right? And I think that there's a reason that we have urgent cares, and it's to get your child the care that they need immediately. But my hope is that you would never have to do that because you're educated on what to look for before it gets to that point.
Yeah, absolutely. Because there are things you can do before getting to that dire stage of the respiratory distress that really needs the ER support, where they have to give oxygen or they have to do even more, give even more support, whether it's with the breathing or medication. So there's things in the doctor's office that you could use, or maybe you even have at home, like breathing treatments that can alleviate and make the kids feel better and breathe easier to avoid the escalation. So all that is, yeah, perfect, great advice. All right, so we hit respiratory, we hit the GI, the vomiting. What's another big one that you see that you think we can teach a little bit to avoid?
Fevers are
Yes.
probably one of
Let's
the
do
biggest
it.
topics.
Okay.
And I think like what I have to say about fevers is I tell parents, regardless of anything with fevers, treat your child, not a number. And I always tell families, I have a 4.5-year-old and a 3-year-old, and both of them have had 104 fevers and they've
Wow.
had 101 fevers, and they look
Mhm.
totally different. And sometimes the 101 fever can look worse than the 104 depending on the virus. Did I
Mhm.
take it in the armpit? Did I take it in the mouth? Did I do a rectal temperature? Did I do a temporal temperature? Like numbers can slightly vary. And so when it comes to fevers, I always tell families treat your child, not just focus on a number. People ask me all the time, like, at what point should I go to the ER for a fever? I'm like, it depends on your kid's presentation. And what do I mean by that? So I go back to my kiddos. My son, we all got COVID in 2021, and my son had like a 103-degree fever, but he was honestly acting okay. He was still eating. He was not lethargic. He was playful. He was still interactive. He wasn't like miserable and plumped over on the couch and just like depleted. Okay. Same kid about 2 months ago had a 101-degree fever from a severe ear infection, which like I did not have Blueberry at the time to take my otoscope. So I had to take him into the pediatrician's office, and he had like 3 days of like 100.5, 101, 101.5 fevers. But I was like, I don't know. He's like, has no other symptoms, like no congestion. He's not vomiting. Like, I'm just going to monitor it. Well, it got to a point where he was absolutely miserable at 101, just screaming
Mhm.
bloody murder. That's a kid that I'm going to take him in to be seen by a doctor. He's miserable. He's like not wanting to, eat or drink. He's wanting to sleep. The kid hasn't napped in over a year. So those symptoms that he was presenting with were abnormal for him. I'm going to worry about that fever. Sure enough, took him to the pediatrician's office. He had like almost pus coming out of his ears because his ear infection was so bad.
Yeah.
But that's what I mean when I say treat your child, not a number. When we all got COVID, we never even went into the doctor because I tested from home. I knew we had it and I maintained his hydration and he was totally fine. And so that's when I say with fevers, I think parents like tend to freak out about them, but really, as long as you're able to maintain your child's hydration, they're peeing at least once every 8 hours, ideally more than that. And they're not showing signs of lethargy. I don't freak out about fevers. Now, one thing I do tell families is if your child has had a fever for 48 hours that has not broken, or a 72-hour fever that comes and goes, that's when I would escalate care, because at that point, I would suggest having a pediatrician check your kiddo's ears, listen to their lungs, check their belly, like make sure that their physical assessment is presenting normal. Because at that point, it's like, why is this kid having a fever for this many days and
Mhm.
it's not breaking. And so that's like my biggest piece of advice. But with fevers, kids compensate differently. When we have fevers and our body breaks a fever, the number one way we know that it happened is why? Because we sweat, right? And we lose fluid, and that's how our bodies cool ourselves off. And unfortunately, in the pediatric population, their compensatory mechanism, or their way their body compensates for a fever, is different than adults. And typically it happens internally, and it has something called insensible losses that we can't see to the human eye. Their body's working harder, their hearts are pumping faster, their lungs are working harder, they're breathing quicker, they're losing fluids internally without being able to really visualize them. So when it comes to fevers, the number one way to stay out of the hospital is to maintain their hydration. Because if we're not on top of these kids' fluid status when they're having fevers, their body's working in overdrive to compensate, and they lose fluids at a much more rapid rate than you or I would.
Yeah. I mean, all of that is exactly what we tell our patients too, that treat your child, not the number. I can honestly say, don't take my kid's temperature even when they feel hot. Like I really just go by their appearance, and
Yeah,
that tells me everything I need to know. I would add maybe one thing when there's an identifiable cause, because I think this is the differentiator. Do I have to go to the ER? Like you said, for the number, or for how maybe it's 2, 3 days that I've had it. If there's a high fever and we don't know why, that's a little more concerning, rather than
totally.
they are snotty and mucusy. They've got a like post nasal drip causing a cough. They're whiny and they're just uncomfortable. Like that's a virus. It's most
Totally.
likely a virus. There's a ton of respiratory viruses. I mean, we just got through a crazy season of them.
Crazy.
And that is the reason the child has a fever, most likely. And it comes with the territory. And so they might be miserable. You try like a Motrin or like an ibuprofen or an acetaminophen, Tylenol. One of the other reassuring things I find is that if they perk up, they feel better with the medication. That means to me, like, okay, they're fine. We can wait several hours, see what direction this is going to go. But you always
Totally.
have like the interim of like, let's go for a physical check with the pediatrician if you need it. And then, as you said before, I think is like one of the most important points is trust your gut. Parents know,
Totally.
your kids better than anybody. If you sense something is wrong, something's wrong. Like go get checked. And even if everything's fine, like best case scenario, great, everything's fine, you get peace of mind, which
Totally.
is invaluable. Like there's no price on peace of mind of a parent to know that you can sleep knowing your child is okay.
100%. And I think too, like what you say about trusting like your gut is like that. I cannot tell you the amount of times that parents trusted their gut and it genuinely saved their kid's life. Like and
Absolutely.
even it goes both ways. Like I took care of a mom. Gosh, it was probably about 6 months ago. I took care of a kiddo in the ER actually, he was about 13 years old, and he was playing tackle football. He got hit playing football,
Oh.
and obviously got a concussion. Got
Mhm.
what, mom did her due diligence. Kiddo got checked by a pediatrician, cleared him, no concussion. In the acute moment, had no signs of any sort of head trauma, other than like, yeah, he got hit, he's got a little headache, but it wasn't like a full concussion. About 10 days after the head trauma, he started acutely vomiting, and mom was like, what the heck? Like, there was nobody else in the family got sick. They have a large family,
Right.
they all
It
eat the
wasn't
same food.
normal.
It
Mhm.
wasn't normal. And mom called pediatrician, and pediatrician was like, oh yeah, it might just be like a tummy bug, because again, 10 days after a head trauma, you don't
Like, who would
necessarily,
think? Yeah.
usually it's like that acute 24 to 72 hours that you think head trauma. But mom was like, I don't know, I don't feel good about this. She brought him to the ER, we scanned the kid, and sure as heck he had a major concussion. And she
Right.
trusted her gut, even though it didn't really fit textbook answers to head trauma. And it didn't really, the pediatrician was super thorough in the initial visit, and it was hard to, for them to assess, in an outpatient setting. And so mom was like, I'm just going to get a second opinion. And we admitted the kiddo and had him on, like neuro
No
precautions
checks.
and
Yeah.
brain rest, and so I to that, like, I just think that empowering parents, that they have absolutely everything that they need inside of their gut, and they know their kids better than any medical provider out there, and empowering parents to trust that gut is like so much of what I stand for, because I have seen moms and dads advocate for their kiddos and save their babies' lives because they spoke up. And then I've
Ooh,
seen
got the
other
chills.
families,
Yeah.
yes, I've seen other families, that are a little bit more timid. And I'm like, gosh, if they only would have spoken up, or if they
Right.
only would have continued, we may have been able to get this child care sooner. And so that is 100% what I preach. And that's why it's in my mission to educate, equip, and empower parents to be their child's best advocate.
Yes, I love that.